You all on the behalf of Rahul Anand tutorial. So as you know that I am Rahul Anand and this is somewhat around my channel whose name is actually the Rahul Anand tutorial. So if you like the work with reference to the education as well as the lecture, so you could often subscribe, like as well as share with reference to what with reference to the Rahul Anand tutorial. So please like, subscribe as well as share. So today I am going to deliver a very interesting topic regarding the examination of and as well as the general health issues. So what are actually these? So let's talk about the CPR, means the cardiopulmonary resuscitation process. So here when I'm telling you about the cardio means what? Something related with the heart rate. As well as in the second I'm telling you about the pulmonary. What does it actually mean? So it means that something related with the lungs rate. As well as the resuscitation means what? Something disturbance which is being produced regarding our heart which should be resolved with reference to the short duration or the short course of time. So this is the condition as well as the normal introduction of the CPR in the cardiopulmonary resuscitation. Now, so let's talk about these in the detail. So primarily, let's talk about the introduction. So for this, you will have to take one note regarding this. Mean what? Mean the rhythm is somewhat like this. Mean the I can help. So here I stand for what? Here I is standing for the emergency recovery. So then the C here stand for what? For the cardiopulmonary resuscitation patient or either end-stage patient. Then N stand here for what? For normalizing the heartbeat of the patient. Then help. Mean what? Here head as well as the H stand here for what? It is standing here for the head till life condition. So I will deliver with that meaning later. So after that what? After that here mean help E. E here stand for what? It stand here for the dry here to here as well as the LP. And here stand for what? Last this process till what condition? Till the circulation mechanism is basically being employed or rather being improved. Then P. P here stand for what? P standing here for the patient life will be saved from the critical condition. Now, so you have understood about the rhythm or the factor. Mean what? Mean the I can help. Now, so I have often demonstrated here with reference to the diagram, so you could understand. Now, so primarily when we are going to give this mean the CPR condition, we will have to understand as well as take the first action regarding our patient. So what are actually these? So our first action will be what? Primarily we will have to check the heart alarm, then check the carotid pulse. So carotid pulse means what? So these are the here is somewhat our carotid pulse is basically being employed here. So you could understand. Now, after that we are often having the certain types of the other points regarding these, such as the temporal arteries as well as the temporal artery. So by this you could understand as well as track down the heartbeat rhythm actually or either the vibration. As well as you will often have to view the heart alarm. Then the second is what? The second feature is actually here. So the place which you are going to give the CPR, the place should be clean from what? So it should be clean. Why is so? This is due to because if it will be not cleared, then what will happen? The patient will get the hazardous complexion regarding the danger or either being accident due to the place accommodation. So the place should be clean in order for giving or either providing the CPR condition. Now, so third will be what? So the third will be here, mean the call for help actually. So we'll have to call the help regarding what? Regarding as well as we have to call the patient or either ask them whether you are okay or either you are not fine. Why is it so? This is due because it may happen that the patient will be in the conscious stage or either it will be in the unconscious stage. So you have to understand the fact. So after that you will have to provide the superior condition regarding the mean the in which the air path or either air accommodating mechanism will be cleared. So how it will be in the or in what direction actually. So we are having two types of the cavity or either region, mean the thoracic cavity as well as the abdominal cavity. So this region will be coming under the thorax as well as the lower will be coming under the abdominal cavity. So the patient will be given in what condition? So it will be given the supine condition or either the supine position. Why is so? This is due to because the body should lie in the 90 degree of the path in which the thoracic cavity will be deviated as well as the here in the abdominal cavity will be deviated in the same region actually. After that, the circulation path should be cleared in order for the best accommodation of the air mechanism. Now, So then the second is what? So you have to do certain of the complexes, such as what? So when we are going to give the CPR, you have to take the rhythm or understand these facts that it will be in the ratio of 30:2. As well as this, so before doing this process, you have to accommodate what? You have to take certain things in your mind. So what are actually these? So head till lip condition means what? You have to drag its head as well as into the superior condition, into the fine condition, into the air breathing mechanism will be accommodated. In the second, we are having what? In the second, we are having the drag your ear in order for the best mechanism for hearing. So you will drag your ear in order to understand that whether the patient is in the conscious state or either in the unconscious state. So this is somewhat the first action or the first approach which you should take with reference to the before giving the CPR. Now let's talk about the procedure. So what are actually the procedure regarding this in the giving the CPR? So primarily when the patient will be in the either conscious state or either the unconscious state, primarily ask whether he is fine or either he is not fine. If he is not fine, it means what? He will be not responding, result in which he needs the procedure or either the care of the CPR. So first approach will be as what? It will be the thumb approach. So like this, you have to pay important role, exact amount of pressure regarding on their sternum. Now, so if I am telling you about the sternum, what does it actually mean? So it is being localized into the lungs region, between the lungs region. So sternum is what you understand. So this region. So I have delivered my lecture regarding the skeletal system. There you could understand and view what does it actually mean with the skeletal system of the sternum. So these are made up of what? So these are made up of actually the costal cartilage as well as the bones. So it is a fused state. So that means it does not break when you play an important role or provide the accommodation or either the force on the sternum. So third is what? Third is very interesting topic. So carpal and carpal as well as close one carpal with the help of the distal filing. So what does it actually mean? Let me show you. So carpal. So this region is basically being demonstrated in the carpal region as well as carpal on carpal. Carpal on carpal, that close one carpal with the help of what? With the help of the distal filing. So this region will be coming under the distal filing. So this should be accommodated as well as closed as well as the loop-like structure like this. After that what? After that you have to play an important role to provide the CPR condition on the sternum. Actually, often we are having the rhythm regarding these in the CPR. So what are actually these? Mean 30 times regarding what? 30 times with reference to the chest compression into the 2 ratio means what? 2 times of the rescue breathing. Likewise, you could often see here in the board. So rescue breathing 30 to 2 ratio. 30 times the chest compression, the 2 times will be the here mean the rescue breathing. After then what? After that we are often having certain things to go in. So this process should be repeated into what of the course or rather what of the channel. So it should be repeated under the 5 times of the repeated course. So all this procedure which I am actually demonstrating here, it should be done as well as it should be employed within what of the time? Under the time of the 10 seconds actually. After that what will happen? It will be impossible or rather difficult for the patient to recover. Why is so? This is due to because when the patient is being arrested from the CPR-like condition, it means the clinical death of the patient. So fine. So it should be demonstrated in the short duration of actually time. Now, so carpal on carpal with the reference, close one carpal with the help of the distal filing. Then between our lungs where the sternum is basically being localized on, there you will have to play an important role to exert the pressure regarding what ratio? 30:2 ratio. Now, so fine. Last this process till what condition? Till the medical team actually arrives. So when there will be the facultative team or as the medical team which will actually arrive, you have to resemble the responsibility towards that hand. After that, you should not do the certain things like you know more or either anything like that with the respective issue. So of course, so when you are going to give the CPR, you have to check as well as understand that this is very simple concept as well as the fact. When anybody can do this process regarding means the recover the patient when they are arrested from the CPR-like arresting condition, when the cardiopulmonary sector is arrested. Now, but you have to take one note that we are often having many types of the persons, such as the Mr. Silent as well as the Miss Silent. So you have to not feel like that in the Mr. Silent or either the Miss Silent, because if you will be doing like that, what will happen? The patient will die in the premature time. So this is somewhat the condition of the procedure. Now if I am telling you about these, the heart as well as the cardiac. So the primary, so heart attack as well as the cardiac arrest. So what does it actually mean? So heart attack as well as the cardiac arrest are quite different. So cardiac arresting means what? It means that something different which is being produced with reference to the electrical activities with reference to our heart rate. Now after that we are often having certain more things, such as what? Such as in this case the pulsation or the heartbeat rate will be either increased with reference from the normal rate or either it will be decreased with reference to the normal rate. So the decreased as well as the increased, increased one will be coming under what? It will be coming under the tachycardia-like condition, as well as the decreased one in the bradycardia-like condition. So either it will be increased, either it will be decreased, or either it will be chopped with reference to the short duration of time. So this should be carried out as well as resolved with reference to what? With reference to the short duration, in the 10 minutes of the time process. After that, we are often having the breathing difficulties regarding the channels. When the patient has been arrested from the CPR-like condition, then often there is something more such as the blockage in terms of the respiratory path. It is. So all these finally lead to what? So all these finally lead to the clinical death of the patient. Why is it so? So this is due to because the electrical defect. This is caused due to the electrical defect which will be resolved within the short duration of time. Now, after that we are often having certain types of the updated mechanism as well as the modern machines such as what? Such as here, in the AED, in the automated external defibrillating machine. So what are actually these? So these are playing important role to accommodate as well as to vibrate our heart rate as well as to give the primary artificial CPR mechanism with reference to their machine only. So these are having certain types of the mechanisms such as the shock providing mechanism here. After that, it often plays important role to demonstrate or either speak you as like the autopilot. So you know autopilot, it will be demonstrating the value or either the nomenclature by itself that what are actually the procedure which are going to be happen. ADC. So these are having the electrode plates like structure, playing an important role to coordinate with the different stimuli with reference to our skin as well as to track down the vibration of our skin. This automatically playing important role to provide the shock. In order for what? In order to provide accommodation mechanism with reference to our heart defect or either the cardiac arresting defect, mean the electrical defect. It is. So this is somewhat the procedure. The one thing which I have left, so what actually this? So when you are going to give the CPR with reference to the adolescent or either the adult person, so all these conditions will be employed. But primarily, when we are going to give the condition or either the process or operating the child, the primary thing you have to understand that what. So on the child actually, you should not apply the pressure with reference to the carpal on carpal as well as apply the pressure close on carpal with the help of the distal palm. Why is so? This is due to because their heart are not mechanized to accommodate these kind of the shock as like the our body. Why is so? This is because our heart is having the way as well as the morphological and anatomical structure more comfort zoned as compared to these mean the infant baby actually. So in the male with reference to the human body, our heart value or as the weight will be around how much? It will be around 300 grams. With reference to the female, it will be around how much? It will be around 250 grams. With compared to the baby, they are not being developed. Result in which one we are going to provide the CPR. The complexion which we have to take is what? We'll have to apply the pressure with reference with our only two fingers like these. Fine? So these fingers. So I often demonstrated here for you. With reference, you could give these pressure on the sternum of actually the baby because they are not having the accommodized mechanism as like we are having the infant, arteries, etc. They are often having the salodes, stanodes as well as the lanodes, often the punctate fibers, four-chambered heart, of course, ventricles, right ventricles, but these are not recognized to accommodate with the stress which we are actually passing or giving. So in the main or rather the human being actually, adult human being. So our sternum is operative as well as it is characterized to accommodate with the certain types of the accommodation mechanism with reference to chalk, to accommodate with the stress with reference to what, with reference to these means the CPR like condition. But in the case of the infant babies, their heart are not mechanized to get this response. Often when you are going to blow the air or when you are going to give this means the rescue breathing like condition in the baby, you will have to understand the blowing mechanism should be in what rhythm? Very important. It should be in the very slow process or either rhythm. Why is so? This is due to because if you blow the huge amount of pressure, what will happen? The baby will actually die. Why? Because their heart as well as their lungs are not functioned as well as they are not being approved as like our body structural organ. It is so. So this is somewhat the process or rather the mechanism of the CPR. So you could often write build. So if you like the word with reference to the education lectures, so you could often subscribe, like as well as comment below in the bottom of the page. Thus I will be knowing that what concept actually you are hungry for or what haven't you understood or either got. So very thank you with reference to what? With reference to the Rahul Anand tutorial. Very thank you.